No, I need to
You
just.
didn't report it, but yeah.
Okay, so we started out with the peptide serum. Now we want to go into retinols, which was the 1%, and our strongest of all anti-ager is the retinol cream. This is the natural color of it. If you notice, the C4 serum is light yellow.
Yeah.
So the stronger the retinol, the yellower it'll get.
For someone that hasn't used your line before, would you recommend them starting with the 1% and working up to the 3?
Yes, and
Yeah.
anything with retinol, can I just suggest, like for example, the C4 serum, use every other night the first week, and then the following week, every night. And if you want to use it during the daytime, it's perfectly fine, just put sunscreen, over it,
And
okay?
you can totally, you don't have to take a break from it before you perform a peel.
You do,
You do.
always 7 days, it's
Okay.
it's a safe zone.
For your clients, but like if I was doing it on myself,
Yes, you don't
even
want,
on myself,
yes.
I'm like,
I mean, I've done it
Make
where
it
I did a
stronger.
retinol the night.
So, real quick, okay, so this, by the way, this is one of the products we're bringing on.
Yes,
Our current products that we carry do have retinol in them, and it's a decent amount of retinol, and their protocol does not specify that we need to have them stop retinols before using peels. Retin-A is different, but our retinols can be fully accepted. So are you saying cover your bases?
I've seen people, like even waxing, they lift and all that. I've done retinol on myself because my skin is like so primed that it will, like if normally let's just even say the Vitabright, which is an enzyme peel, I could usually stand it for 5 minutes, but if I've done the retinol the day before, it's gonna go fast in the skin. Does that make sense?
no,
Yeah.
totally.
I guess it's just if you know the person's skin pretty well and you know that they can handle it. I mean, are you like okay? I just want to have a raw conversation about it.
Okay.
Okay, not a high warning safe conversation. Raw conversation. You've been using this product line for a long time. Would you stop a 3% retinol to come in for a peel?
I would say and I'm being truthful because I've seen people get damage or people get, problems. If it's the 1%, 3 days. It's a safe zone.
Okay.
But the 3%, definitely 7 days. Because I don't know what your retinol percentage is,
Right.
but this is equivalent to 0.05 of the retin-A.
Oh,
So that's
okay.
the second level.
That's
Okay,
higher
so then
than
The
that
highest is
Yeah.
0.1.
Okay, got it. No, I understand
Yeah.
that.
That's why.
Okay,
So-
so because this is a product that we are going to be carrying in our inventory, you gotta always ask them if they got this product. Even if they're your regular client, what if they came in and talked to Sia or Bella or whatever, and they ended up taking it home? So always just say, are you using any retinols right
I
now?
usually, that's my screener. I do screen my clients, and then, but the clients that are using our product with the retinol in it, I'm like, it's up to you if you want me to perform the peel. It could make it a little bit higher. You might have a little bit of downtime, flaking or redness. Not typical, but it could happen. Do you want me to go through with the treatment? And they're always like, yes, I would rather peel.
Well, I guess a lot. What I'm trying to communicate is that a lot of the general public doesn't know if it's a retinol thing. They're like, oh, I use this moisturizer,
Yeah.
and they don't really know.
Yeah.
So that's why I'm trying to really make sure that because we're using this, just they're using the Lira line, and they say yes, just they're using this product, and
Yes.
give them a visual.
Yes.
Because if you don't know, they're gonna be like, oh no, I'm just using this cream.
Yeah.
It's good stuff.
It's good stuff.
Yeah, and they won't know.
Keep
that
in mind
that's
this is
retinol.
clinical professional product, so it's gonna be higher, the percentages and so forth, or the activity. Yes.
My question, as for Fitzpatrick's 4, 5, and 6, stick to the gun on this. Like when it comes to
Start them off
start them
with
off low and then move them up.
Yeah.
And
Like
then if they're using this, don't have them do a peel for that 7 days, right?
Yes,
Yeah,
for sure.
that sounds like, I mean, that makes
My
sense.
other
right?
question
Yeah.
is the 1% we're not bringing on.
Oh,
So
we're not?
I thought we were.
what is that?
C4?
Oh, we are. Just kidding.
Okay. Yeah.
I'm sorry. I have the Cliff Notes.
Yeah. I'm like, let me say the name.
Not like the full thing. So
Just so
here, okay.
some of my accounts would do is because they do have other lines. What they do is like start them off with the other line and then they move them to this. especially for adult acne.
So you guys have a 1% and a 2% and a 3%, or just 1 and 3?
1% and then 3.
Okay, so
Yeah.
we are carrying both of them.
Yeah.
Okay.
And if you want it even stronger, you could layer the serum and the retinol cream.
Oh,
So that's the highest level. So the retinol cream then is 3% retinol, which is equivalent to 0.05 of your prescription retinoids. And then it's got 7% lactic. So it really helps to drive it in even further.
And it would be moisturizing because of the lactic.
Exactly. And more exfoliating as well too. So resorcinol, resorcinol is also a brightener, and also the hexyl resorcinol, as we all know, mulberry extract, and your BVOC vitamin C. That is all brighteners right there, and your Botox-like peptide is your argireline. So it's great for anti-aging.
Seems like a great night cream.
Yes, but the key is to start them off again slow.
Slow.
First
Right.
week, 2 nights.
Okay.
Following week, 3 nights.
Okay.
Really slow.
Really slow.
Yeah.
So,
Okay.
quick question, Rose. Teen clients with acne, like grade 3 and up, can I put them on that, or should I start them on
BPO.
C4?
I would put them on, if they're not allergic to benzol, put them on benzol.
Okay.
Teens respond better to benzol because of that acne.
And
Well, I was
it's
thinking because of
oxidating.
because of the cysts that they get,
It
the
is,
retinol
it's
is good for
oxidizing,
that.
And kids, teenagers, they don't
But
want
you want to
right?
attack that
So if they can
bacteria
do
more.
it that way, do
Okay.
it that way. Or what you can do is instead of treating benzol every day, benzol treat them once a week.
Right.
Do it that way if they have dry skin.
Yeah.
Or that's like, or you can mix a little benzol with like a moisturizer for someone that's drier. But that's why they give teenagers benzol.
Yeah.
And it's 'cause
To
they
really-
don't.
It's funny, they gave me Retin-A.
They give
Back
that
in the day,
14.
that's what
They
they
gave me
do.
that as well.
Yeah.
That's what they do for
14.
because that's
Cystic acne, right?
Yeah.
Yeah.
Something.
Yeah,
Okay.
but now we know that benzol goes
Better.
deeper and it kills that P. acne bacteria. But if you need to get off of it, then retinol.
But do the C4 for them first? You can
Absolutely,
start them on
yeah.
the C4 and then the Fermi cream. Okay.
The retinol cream.
Right. I mean, you know what I mean. Yeah, the retinol cream
Yeah,
versus.
but
okay.
I would definitely go for benzol first.
Okay.
So anyway, so this is a fabulous anti-ager, but again, slowly. Most people will respond and have the effect by using it every other day.
And I know with a lot of lines, I don't mean to cut you off.
No,
there,
that's
I'm
okay.
so sorry. I'm like
No.
kind of like ahead of myself,
I know
but
it's a lot.
some product lines they'll say, oh, you're not going to really see much happening for like until you get to like the second bottle. Do you see that with this product, or do you see pretty like instant, like within a couple weeks, like they should notice a change?
Absolutely. For retinols, you probably see the difference in 2 weeks.
Okay.
They will probably see the brightening like right away, even with cleansing their skin.
Okay.
They
You know,
say typically with, I'm sorry,
Go ahead.
typically they say 10 days with retinols.
Okay.
yeah.
That same with the visual changes line, it's 10 days.
Mm-hmm. Yeah.
Even like, but you know how like with the peptides with the resurrection, there's
That takes longer.
that
though.
takes longer.
But that's probably the same with yours as well.
Peptides takes about 30 days.
Yeah.
okay.
And it's cumulative. If they're using it here and there, they're not going to see the effect.
So
It's
that's-
cumulative. It
And that's
builds
why
up.
they say with the visual changes that they need to use it cumulatively for 6 months to see the full result, because it does start to just store over time.
Peptides, I feel like our peptides, I notice, within like 30 days is your good safe zone to see the difference. Yeah.
However, if they're using retinol, isn't that just going to deliver the peptides faster? So then they're going to see the peptides work faster, right? Because retinol
Not
pulls things in.
the job of a peptide is to penetrate the skin, regardless,
Okay.
right? But if you're smoothing out the skin and also doing peptides, yes, of course you're going to
You're
get
gonna see it
the
faster.
result. It's not driving the peptide fast.
How it was
Okay.
described to me, and this is kind of I always told the client, is if you were to imagine a brick wall and all the glue in between the brick wall, just like, you know how you see like an old brick wall that's
Yeah.
like kind of coming down, and then you start to use that peptide. What the peptide does is it rebuilds the glue inside
Okay.
the wall. So it
Okay.
takes time to like put the glue back up to get the wall to perk back up.
Okay, got it.
If that gives you a visual, because
Yeah.
the peptides help with the structure of the skin,
Right.
not the skeleton, because there's no like. But if I were
It's
to
the
say,
Yeah.
it's like the
intercellular glue.
skeleton of the skin,
glue,
if you will.
right,
Yeah.
yeah.
it's
Intercellular
like-
Like the glue.
yeah.
Okay.
Okay, so and then we have the lash product, which is It's non-prostaglandin.
Nice.
It is a peptide and plant stem cell based, so it's not going to irritate the eyes, and it's great for the brows as well.
So it
Oh,
stimulates regrowth, or
It
just
stimulates. What it does is allow more blood flow to the follicle, so you're producing silkier, stronger hair.
really?
Yeah.
Okay, that's awesome because I do have clients that come in.
Well, yeah, we
Works
were.
too well.
Work on a client that was a fitting brow.
Yes.
It would.
Yes. So just put it in there.
That
Twice
works.
a day.
That works too well.
I think it's less than 8.
See, my cat did.
So for like also for like
Yeah.
lash extension, it helps to
Or like reactions.
Condition the lashes so that they're stronger, so they're not breaking.
Yeah.
Yeah.
Oh.
So it doesn't break down.
I like that.
Mm.
So they can
Yeah.
put that on, like,
Every
Every day.
lash extension.
yeah. Did you guys hear that though?
Yeah.
So for
that's
people
so
that have lash extensions, this can be used to moisturize their lashes, like on their thing every day.
It keeps the integrity of the lashes. So any
Would it loosen up the?
no, we've tested it. Any questions on the Pro line?
Yeah, it sounds
You did a very good job
Thank you.
explaining.
All right, so Bioline, what we've designed this for is to bring back the health of the skin, or keep or maintain the health of the skin. This, the first one that I'm gonna pass around is the enzyme cleanser. And the enzyme cleanser is very mild. It's papaya and pineapple enzymes, as long as they're not allergic to those fruits. It can be used around the eyes without stinging it, so anybody with eyelash extension, it's not gonna break down the glue, and it's very, very mild. Okay?
No, I know. Makes sense.
We're gonna bring them
On the
to
video.
the Pro, and then I'll probably do,
I think you should.
but I can't.
Yeah.
We'll talk in our meeting.
Okay.
What were you allergic to?
Me?
Weren't you allergic to something particular? No? Maybe you, I'm making it up.
She's like, wrong class, huh?
No. Somebody was like
It smells
completely
like
allergic to
Put
mango.
some
I think it
water
was.
in there if you wanna tap your hand on there.
Now, is this a cleanser that you don't need water for as well?
All our cleansers is better without water if you're doing it in your treatment room.
Real
Like when
quick,
you have to
this is,
use.
this is not a line we're bringing on right.
Oh, so you want me to skip this?
No, you can go over it, just kind of go through it quickly because we are running a little bit
Yeah.
low on time.
Yeah.
I rather focus mostly on the Pro and the other extra products that we're bringing on, and maybe just some of the acne lines. That would be the next. That would probably be the next line I would go with.
Okay.
Because
Alright.
we need another acne option.
Okay.
Question, so how you said these cleansers work well with water, does that mean we'd be running on back bar, we'd be going through cleanser a lot faster than some of the
You
other?
probably would.
So
because you
maybe
need that.
ordering wise, order more cleansers to
We
like
do have the
bar?
back bar size if you find that the
I did
cleansers
not,
are
just so you know, I did not get large sizes of anything
Yeah,
this first
yeah.
go around.
Yeah,
Mhm.
So
that makes sense.
I just want, we got the small stuff, we gotta kind of bring things on small, wanna get your feedback, that sort of thing.
Are we gonna create like a Lira little basket in the
You're gonna have it
closet?
in each way room.
Oh, we will.
Yes.
Okay, just wondering.
Yep.
Okay.
That's what I said.
So I'm just gonna go through this because I know we're running out and because I want to focus on the ones that you guys are bringing in. So Hydra C is our hydrating vitamin C, same formulation as your C4 serum, but this is a hydrating version. This is our #1 seller for all skin types, and it's a light moisturizer as well as antioxidant. The Hydra Infusion is our answer to hyaluronic acid. It's like hyaluronic acid on steroids because what we've done is incorporate silver ear mushroom to double the effect of hyaluronic acid, and it's also got the calming and healing, the calming B5 and healing colloidal silver and gold. So it's very nice, to add with your serums. It is a mega hydrator. Our BioLift cream, we didn't bring that in, huh? This is our peptide cream, excellent for the neck all the way up. It's got the same peptides as the serum. We opted for the serum, and then we opted for the caviar as your cream. It does have those 2 new peptides, the cyclopeptide 5 and progeline, okay, as well as those Botox-like peptides. And then the caviar cream is what you guys brought in. We opted for that because I guess you have quite a lot of more
We want to
drier
focus more on
skin.
anti-aging, that
Yeah.
mature,
And it's more luxurious.
menopausal type of skin type.
Yeah. Yeah, that's
Well, that's
me.
true. Oh, this is cool.
So,
But there's a little inside trick, back bar only. You can twist that cap.
The white?
No, the silver.
if you don't know how much
Yeah.
product is left, you can twist it. But all of our packages
Or-
have been tested to take out all the products out of it.
Yeah.
I will get you guys the larger sizes.
I think that hyaluronic.
It's a good one.
I think that's a really good one. I mean, I would think that you could incorporate that with the anti-aging.
You can. What's great about this line, what I like about it is you can use this with the visual changes and you can use it with the Casmara. That's the reason why I like Casmara too, because it can be interchangeable. And
Valeria uses some of our Lira
Yeah,
in her
she does.
bar.
Yeah, she does.
that's why I like this line, because you can mix match, you can use a little bit of this and a little bit of that, and it's totally fine. It's not gonna interact.
What do you think about the hyaluronic?
I like that.
I like all of the product. Yeah.
The hyaluronic's a different method, the way you're used to it. Usually you put the hyaluronic on after cleansing, and then your serums to pull the serums in. It's the other way. You put the serum, and then you put our Hydra Infusion on top. What it does, it causes it pushes the product in and also causes a semi-occlusiveness, so it keeps the moisture in the skin.
Oh, interesting.
But yeah, it still allows for your cream to penetrate.
So wow,
Yeah.
okay.
It's the other way around. It's a new technology. Yeah.
Okay.
So caviar cream. You guys are gonna be having this incorporating this. The caviar cream, super hydration. The caviar works again with your omega-3 and 6. Very healing to the skin. If you notice, all the skin brightenings ingredients that we've incorporated: the plant stem cell Madonna lily, azelaic acid, mulberry extract, gooseberry, and oligopeptide 51. To soften the skin, because more mature skin sometimes need that softening, is that kukui and macadamia oil to really condition the skin. Yes,
How come that
Smells amazing,
Hexyl resorcinol's not in it?
we instead use all these other brighteners.
Okay.
Yeah.
Good catch.
So post-procedure, all your ladies, if they have plastic surgery, it helps their skin heal faster. Also, 2 or 3 days later, you could use this as your moisturizer to heal the skin faster as well. When your skin is hydrated, it'll heal a lot faster.
Grade 2 pills. It's like you have to go home with it if you want to do the grade
We
2.
got your stuff too. That
Or ointment?
yeah.
We haven't had that in a while.
They were out. They were out for a while.
I
They
actually
were,
like.
are they still on back bar for it?
I'll
They were on back bar
I
for
actually
it.
like this better.
Ooh, this smells really good.
They
Well,
stopped
For
carrying.
just because it's a.
They stopped carrying.
Well, then maybe we switch over to this.
So the Hydra Mineral Mask is it's a healing and hydrating mask because it's got all the
I don't know
minerals
about
in
that.
it. It's multi-peptide as well as it brings the hydration to the skin, and it's also a lightener. But it's a mask that you could also customize by adding retinol to it, like our retinol peel or a Prolite to pump it up even more so as an anti-aging mask.
So could you use this like as a treatment? This vest?
Yeah, like
Like at night, like
Yes.
before you go to bed?
Yes,
You
absolutely.
could. Okay.
Absolutely, yes. So it's a nice finishing mask for your back bar and also for home.
Okay.
Yeah. Like sunburn, windburn, beautiful.
Beautiful, right?
And you could even refrigerate it, yes.
Rose, with the caviar cream,
Mm-hmm.
is this also healing? Like, can
Yes.
eczema clients use it? All our clients, okay, good.
Yeah, because it works with your
Rosacea.
omega-3 and 6.
So much more
Absolutely.
and I think it
Same with the violet.
hand sanitizer now.
So Recovery Balm, I thought I had it, but I think it's in my purse. Recovery Balm is our answer to Aquaphor or Vaseline, but better because it's super light and it has colloidal silver to really heal the skin, and it's got vitamin A, it's got gold. It's like your, is it A and D for like tattoos and stuff? So it helps with like really dry, dehydrated lips, dry spots, eczema, psoriasis. It really helps you keep that hydration in. Like if you lift skin in the back,
Yeah.
you want them to go home with something over that exposed skin, so that way they don't.
So it's like your version of hydrocortisone cream.
Exactly.
So
but
this would
better.
actually be like the
So
comparable
it's like
to
our
that
first
herbal
aid.
ointment.
So this would be like if you're doing Jasner and things like that. This is our aftercare. Our doctors do that, and laser
We'll talk, let's
We'll,
talk.
And
we'll
laser
figure
cut.
it
Is
out.
it-
This is good.
Okay,
It's
so
like a finishing mist.
this mist could be a finisher, a toner, or also a hydrator. It's thicker than a normal toner, so we don't call it toner. It's actually skincare for, it's actually skincare because it's basically colloidal silver and gold and antioxidants and plant stem cells. The thing about this, because it's a heavier liquid, is you really need to commit. You can't do this because it spurts.
Yeah.
You have to like really,
You have to commit to it.
I like
Is
that.
this like,
You have
I missed,
committed
is this
to
like a
it.
toner?
It's like a toner, so it helps the serum
So it's like a
penetrate the skin
hydrating
better.
mist.
Yeah, or a finishing mist, or some people use it like post wax. Somebody with sunburn really helps with that with a mask. It's really nice.
Post face wax, that would be cool.
Yeah. So we have the pH solution for the back bar, but this is the retail version. Okay, so it's because we wanted it to be
Oh, that's the
TSA approved.
pH solution. Okay.
Now,
I know what that is, yeah.
Yeah. Okay. So lip factor, that is our moisturizing lip factor. It does have the maxi lip peptide to help hydrate and plump the lips. So sorry, Messi cleanser. That's our only creamy cleanser,
Ooh.
and I'm kind of like going through this really fast. It does help to remove makeup. It's great for a pre-cleanse if you want that. It's great for dry, dehydrated skin and pigmented skin. And then the C15 booster, this is our highest level of vitamin C. It is a treatment for the skin, not a moisturizer or anything like that. It does remain on the skin up to 24 hours because it is oil soluble, so you don't have to put it on twice a day. And it does help brighten the skin. If you've got a darker spot, it will brighten that up. So that's one of our other strong brighteners. We only have one eye cream, and it is in this line. And what we've done is we didn't incorporate acids or anything like that, just peptides, strong peptides to tighten up the hot eye area and also treat purple dark circles and brown dark circles. And this is our polisher, which is an exfoliator as well as a mask. You could leave it on the skin and then massage it in the skin, and then it'll exfoliate the skin, and also leave it on for this colloidal silver and gold and massia to penetrate the skin, to
Is it like
soothe
a
and calm the
scrub?
skin.
Let's have 72
Yeah.
hours post peel.
So
Yeah.
your clients
You
that
could
love that old
Polish off the
Same
dry
here.
skin.
Oh, okay.
they'll love it.
It'll hydrate it too.
Doesn't it smell like it? Oh, she hasn't passed it.
And then lifting mask is a seaweed mask that helps that instant lifting and hydration and healing the skin. It's great for your facials. And then this is something that you guys are going to be bringing in is the dry oil.
This is, what do you call this?
This is the beauty oil.
Oh, this is the beauty oil, so.
How would you use
I'm
this?
obsessed
So this
with it.
one you would use for somebody that's drier and needs to soften up their skin. Somebody that has some heat on their skin, it'll lift that heat. Somebody that's let's say oily acne, it actually helps to balance out the sebum production. You were saying BPO over dry, they could use the oil.
I'm
And you
obsessed
can
with
add
it.
it as like a boost in like a mask, right? Or
Absolutely.
like a moisturizer. That's
Yeah.
how you add it, or you put it on because this is a product that we're carrying, so be
Yeah.
very specific on how they use
Yeah.
I love
so
it.
it's dry oil. So like for example, we have a BB line that's kind of chalky for me. I put a little drop and it just goes on silky.
Yeah,
Somebody-
your face is so soft when you use it.
Yeah.
Maisha got it for me.
So your
Right.
skin really, it helps to soften it up and regulate that
My-
sebum
yeah, I
production.
love it.
It does have hemp. It
You
does
gotta
have the
open it.
Madonna lily plant stem cell to brighten the skin, and the massia, the mastic.
You only need like a little
Um,
bit, yeah.
So it's an anti-inflammatory as well. So somebody, you guys have had clients with like heat in their skin. It helps to lift that. It's actually our post for like the heavier peels when we do advanced
It
peels.
feels so amazing.
So this is the acne line, and again, we're gonna go through it pretty fast, and then I wanna, be specific to the ones that you guys are carrying. The Sal Cleanser is 2% Sal, and it's excellent to regulate sebum production, to cleanse. It does have healing peptide delivery system. It is antibacterial. Don't be afraid when somebody has oily rosacea. It actually helps with the inflammation because aspirin, helps with that. The cleanser will help with that too. Unless they're allergic to aspirin internally, please make sure you do a PD test. More than likely they're not going to be allergic topically, but you don't want to take that risk. Okay? Like Maisha was saying, 2% salicylic, up to 2% you could use on pregnant clients, but please make sure, if you don't want that liability, that the doctor okays it.
So, being that I just had a baby, I brought in all my stuff and they looked at it. Salicylics is still it's like a level C or 3 or whatever, so it still is on their map of you need to be careful and cautious. They can say that it's safe because it's still on that map, but it is a higher risk product.
Absolutely.
On a pregnant person. So you just need to be aware of that. And if you do get them on salicylics, and they're layering salicylics, you're making that percentage go up and up and up.
And it stays, if it's something that stays on the skin, you don't want that.
So usually what I would say is, hey, just so you know, there's a 2% salicylic in it, and just run it by your doctor.
Yeah.
I just always made it very just run it by your doctor. It is considered pregnancy safe.
Because you don't want that
Run it
liability.
by your doctor.
The person that I did it on was a close client, so I trusted, that she was gonna do, and we were just doing cleansing. She couldn't do anything else, but her acne was she was breaking out everywhere.
And I honestly, I wouldn't worry about it if they're just coming in for a facial. It's a one-time thing.
Yeah.
I wouldn't worry too much.
No,
about
she was
that.
using it at home.
Okay, yeah.
So that's why it was
it's gonna accumulate in their body. That's where you gotta be a little.
But I pulled her off of all her other acne stuff and just had her use just that, and that balanced her so that
That smells
because the baby was making her purge everything. She was just sister.
I had the same problem.
Just
my skin.
and look at Isla's skin is beautiful. My friend's daughter was beautiful skin, but gave you horrible skin.
The first 6 months I had terrible acne, and then it just went away. And I had beautiful skin.
My daughter too. She couldn't control her little tiny acne. She never had acne before. So 2% sal, be aware of that. The balancing lotion is 1% salicylic to regulate that sebum production. This is our oil-free moisturizer. Okay, so for your grade 1-2 acne, this is excellent. It's got healing delivery, peptide delivery system. It does have anything that's left on the skin is going to have topical probiotics.
I really like the way this feels. This is more than likely going to be the next thing that I bring on is the entire line. I like it. I think that it speaks to that clientele, and we need it. We've been needing another acne line for so long, and I've looked at a couple different ones, but this one I just like it.
Yeah.
You like the way it smells?
I like the way it smells. I like the way that it feels. I like that it's a simple program, and I like that it just adds to the Lira line. So.
The next one is a BPO product, so it does have 5% BPO. It should be used day and night. I tend to like to use it at night better than day. For me, because it does have benzoyl. Now that is benzoyl, although they say it's okay to use on pregnant women, you need to check with their doctor and make sure that they okay it.
Careful, that's got benzoyl and it'll bleach your stuff.
Yeah. Okay. The clarifying scrub, I love this as your cleanser instead of the sal cleanser for those that have high grade acne.
Okay.
Temporarily.
Okay.
So they should be using this scrub. It's kind of liquidy, so be careful. It has
on people that have pustules.
grade 3 and 4.
Yeah.
Really?
Yeah.
I thought you weren't supposed to use a scrub on people that have grade.
Try it
The
first.
light, I mean,
Try
we're
it.
talking educating your client as a light because what the scrub does is actually deliver the BPO further.
And so it's not like let me feel it.
Feel it.
I think I know. It's like a.
It's very liquidy.
What's that? What's the line I
But
would
how
use?
often would you have it?
St. Ives?
No. That
To really
three-step
attack the
product.
acne,
Oh,
use
pro-
it
proactive.
once.
It's probably like proactive
Once a
scrub
day.
where it's just got a couple. Oh yeah.
Yep.
It just has a couple beads in it.
Yeah.
It's not like beady.
Yeah.
It's not like the derma scrub
Yeah.
would be.
So chest and back acne,
This is
excellent too for that.
This would be
They're
great
not allergic.
because I get a lot of clients with back acne, and it'd be great to have like a I feel like we talked about this. Remember, we're kind of winging it with the treatment.
Oh, the back facial.
Yeah, that'd be kind of cool to have.
Yeah.
You know.
So 1% of your population is highly allergic to BPO, so be careful.
When you say
Um,
BPO, is that
Benzoyl peroxide.
What's the O stand for?
Benzoyl P and an oxide.
Oh,
PTO.
I didn't know that.
You didn't
Oh,
think
God,
that?
I
You didn't think
I thought it was
that?
just
Look,
like
I told you.
I thought it was just BDP.
So you don't want to use it for
It
long
smells
periods of
good.
time because it does change the texture of your skin because of too much oxygenation is also not good.
And
Right.
benzoyl peroxide will bleach the skin out.
Yeah.
So if you have someone with like a higher Fitzpatrick, it will start to leave splotchiness on the skin. It'll give an uneven skin tone.
Yeah.
To the
And
skin.
also the texture
Yeah.
changes. So
That smells good.
so it's good to use 2 to 3 times as your treatment for your grade 1, 2 acne, but when you've got higher grade acne, have them use this as a cleanser until it clears up and then move off of it.
Okay.
And then your refining mask, like I said earlier, the oilier T-zone, where is my refining mask? It disappeared. Oh, here. So our refining mask, I love the way we've reformulated it because it's now charcoal, it has charcoal which detoxifies the skin. And also the kaolin clay will pull the impurities from the skin, like those, in the nose area. It's kind of like Biore. I call it like our Biore.
Okay.
But it doesn't have the activity like a lot of masks do. Kaolin
These
clay
ones they
masks
have
do.
mint in them.
Yes,
Is it
peppermint.
mint?
It
Oh,
smells
it's
so
mint.
good.
Yeah, they do smell really good.
Yeah, you know how acne clients always wants that fresh feel?
Yeah.
That's why we incorporate a little bit of mint.
Smells good.
Yeah.
And peppermint is anti-inflammatory.
Yeah, so it's got lactic and malic acid and 2% salicylic in that, so that way it exfoliates it as well as, controls the oils. And that charcoal powder is great for you detoxing, okay? And then the clear stick is your daily, your grade 1, 2 acne or those deep-seated lesions that want to come out, but it's painful, so you start treating it. So because it does have that resorcinol, it drives that salicylic
That's what I need.
deeper.
Did they change the formulation
Yes,
on
they
that,
did.
Rose? Because that used to be real strong.
Yeah.
I sold it to some
It
of my
used to
clients
be-
and they would be like, oh my God.
Yeah.
Like,
Yeah, yeah, and also the applicator is a sponge now, so
Okay.
it's more gel-like instead of liquid.
liquid?
Yeah.
Okay.
So you just keep applying it on
They like a cystic one.
Ooh, I get
like
it.
the really bad cystic
Or
ones.
spot
Isn't
treatment.
that like
Yeah.
a bacteria? Like what if they have like a pimple that's like
The
leaking?
resorcinol kills the bacteria.
Yeah.
So you don't want to share it because the rim could, have the bacteria, but for their own, that resorcinol actually kills the
So
bacteria.
just to be clear,
Uh-huh.
someone's got some oozy pimple.
Get
After
Q-tip.
they've like washed their skin and they're impatient, don't want to wait to put it on, they can put it right on and it will be fine.
Yeah, the resorcinol will kill it.
Just
Keeps the
wanna-
antibacterial.
The
But it used to
resorcinol will kill it. It also
Double check.
penetrates deeper.
Like overnight,
why
the
that-
zit is gone.
Can you buy it?
I'm not saying that it doesn't work. I just get grossed out by that.
Oh,
But
but it's
then-
just your acne.
then-
It's just you.
Personal thing.
Yeah.
Then
Yeah.
have them do
Use
a
a
Q-tip.
Q-tip.
Yeah, they
That's
could use a
fine.
Q-tip
That smells
too.
really good.
But if that's why I asked her if they reformulated.
We have one rep who puts it
You
around
said
the eye area.
really
I know the
important.
eye area because of the resorcinol.
What?
I'm not kidding you. I haven't tried it because I'm afraid.
Okay, right?
And my hand feels really good.
Okay, so
Scared.
the rest is gonna be the BB and so forth. So let's concentrate on the ones that you guys are carrying. So we have the cleanser. We'll go over that cleanser again. 10% lactic, 1% sal. It helps with the exfoliation and brightening of the skin. And then we have the C4 serum.
Let's do this. Can you put them in
Yes.
order right
Yeah.
in front so she can get a video
Thank
of
you.
it
Oh, yeah.
really quick, and then you can kind of pass them around and play with them if you guys want to like look at
Okay,
it.
we have the retinol
Pro light,
cream.
right?
Yeah.
Are we doing pro light, Julie?
Nope.
No?
Retinol cream.
Okay.
And what else? The oil. The oil is in
Right here.
Oil. What else was? Did we have the?
The caviar?
We have the cream cleanser, the pro exfoliating cleanser, the hydrating C serum, the pro C serum, peptide serum, pro retinol cream, peptide cream, beautifying oil, and then you made an adjustment.
It was instead of the Bilift cream because we already had a
There was an
frozen
adjustment.
syrup.
This
We
is
went
our
to
my
caviar.
notes.
Okay. So
Pro-forming?
okay.
So 1, 2, 3, 4.
Are we gonna do an eye cream?
No, because we already have our eye cream.
What else did we have there? I don't have my notes here. Let's see.
So
we have 8
Thanks,
products.
girl.
the C15?
So we got
Did we do the C15?
No.
no, I don't think so.
No.
You made an adjustment on our order though, so
It was either I changed out the Bilift for the
Any of the
caviar
acne?
cream.
no, none of the
Not
acne
yet.
yet.
Okay,
None of the
so
acne
none
yet.
of
This
that.
is just what we're starting off with, and we're gonna add to this. Yeah, but we'll.
This was the eye cream. This was the
We only have
Pro
the
Light, the
six.
lightening serum.
She's gonna take a look at the order really quick. Just
to be clear, because we put the order in about a month ago.
We're doing the Hydra C.
When will it come?
They'll be here tomorrow, right?
I think today.
I just
got a package.
I
got
oh,
two
you did?
packages.
Okay, so then we'll talk about this in our meeting.
Yeah.
Okay, that's good.
Hydra C.
Oh, it's on my computer.
Hydra C. Well, she switched something out, so I
Okay.
want to make sure that she takes a look. Because
Okay.
we were talking on the phone, like, what was it, like a week ago? 2 weeks ago?
Yeah.
And she's like, you know what, I got to thinking, instead of this, let's do this, because this is going to be better.
Instead of the Biolift cream, I changed it to the caviar cream.
Okay, yeah.
So this kind of goes with what I wanted to do
What do you mean?
for my little presentation.
Need two more.
So that's why I wanted to keep kind of the products out, because I can kind of
Okay.
loop it
Okay, here we
into
go.
that. And a few of the visual changes products too, when we do our own little thing.
We're going to do that next. I got 15 minutes.
I know. I gotta
And
run
then
through it.
I
Quick.
know.
I'm gonna just do it quick.
Yeah.
We could
So we
always do
have the
it.
pro
We will do like a
cleanser,
15
the pro
minute with our
firming,
group, and then I just
C4,
want to
retinol,
cover
okay, that's
individually.
4.
Okay.
Touch
And
base.
then we have, oh, we are doing the Hydra C,
Okay.
caviar cream, and then the C cleanser.
So let's color code it. So this goes together.
I'm sorry. You got the oil?
Yep.
Okay, you got the Hydra C?
Yep.
Is there a reason why you're putting in that particular order? Or
Yeah, because they're line related.
Oh, okay. There we
So
go.
Mystique, Bio, and Pro.
Okay.
Cool.
Alright.
Put a little separation in between them so you can.
Kind of know which
Yeah,
one.
because when someone is watching this video for the first time, so they understand that there is
Pro, Bio.
3 different things going on.
And there we go. Yeah, put the tops on. that one goes. I think that one goes on that.
You gonna keep going?
Well, are you? Is there? Let's just see if she has anything more to
Okay.
add to this.
All right, so as a recap.
Yeah.
So we've got the anti-aging line right here. Let me see, let me get some separation. So this is the Pro Cleanser, which is your lactic and salicylic to help exfoliate and brighten the skin. And you've got the next one, it's your Pro Firming Serum, which is a peptide serum for prevention and correction, and also brightening the skin without using acids or retinol. And then we're gonna get to the next level of anti-aging, which now involves retinol, which is 1% retinol with 20% vitamin C, which is also an antioxidant. And then we have the cream, which is your highest level of anti-aging, 3% retinol with 7% lactic, okay? And infused with, it's also in a shea butter base, and it's also brightening as well. So for hydration and antioxidant, you've got the hydrating Hydra C serum, which is 20% blend of the 5 different vitamin C with hyaluronic acid and brighteners. And you've got caviar cream as your highest level of moisturizer. You could use it day and night. And the caviar is excellent for healing the skin. And also it's the closest omega-3 and 6 for your own skin. So that's why it maintains that hydration and pumps up that hydration as well. And then we have a cleanser, a creamy cleanser, that's great for your pre-cleanse. Also to remove makeup, excellent for your pigmented, dry, dehydrated skin. You could also use that as a massage medium. And then you've got your beauty oil, which is a dry oil that can be used for all skin types, everything to regulate the sebum production, reduce that the size of that comedone. It also helps with that thermal heat by lifting the thermal heat from the skin. It's excellent to soften up the touch of the skin, and it's a super antioxidant with your BVOSC and brightener as well. Okay, so those are the 8 that you guys will be bringing in, and if you guys have any questions, let me know.
Okay, thank you
Thank
so
you.
much,
Thank
Rose.
you.
That was extremely helpful. You were very thorough. I appreciate it.
Sorry that I flew through that.
You're fine. You did great. And then